Ladies and gentlemen, welcome back after lunch. My name is Dörte Döpfer, DD as in digital dermatitis. I make this joke more often, but it doesn't work in Japan. And I wanted to make sure that you are aware of the lameness in ruminants symposium taking place next March, between March 10th and 14th. And Sakute Ryuku is on this t-shirt, the power of hoof trimming. And make this the power of female hoof trimmers, as Charlotte is going to explain a little more. Clinical evaluations in histology to test the effect of amino acid complex trace minerals on digital dermatitis in beef cattle, in finisher cattle. We wanted to try, or we are in kind of a big awareness campaign about digital dermatitis in feedlot cattle in the US. I'm here as the first author, but there's a plethora, a long list of co-authors that you will see in the abstract. And so if I stand here today, that's because many, many people helped with this study. DD, or digital dermatitis, is not foot rot. Producers of beef cattle are increasingly aware of the fact that DD is an endemic claw disease that causes severe lameness and outbreaks of lameness, causes severe economic losses, and is a very laborious task to prevent and control once these outbreaks are on the way. And my message to those beef producers is DD is here to stay, and it has many, many faces. We are distinguishing between DD lesions that occur early during the finisher period, like after 60 days, let's say. And there you get these lesions here in the back around the coronary band of the claws, deep crater-like tissue losses, and lameness that does not occur or kind of develop overnight. It's not like foot rot, where you have overnight acute severe onset of lameness. No, DD develops over time. So these are early lesions in the beef world, while when you go to the late finisher periods, you get huge lesions with extremely lean cattle that, and these lesions look as if you took like an axe and you slashed away the entire heel area. Severe, severe well-being problems. So DD is here to stay. And again, DD is not foot rot. If cattle show lameness due to DD, then the prospects for successful treatment is minimal. Once they have DD, you are too late. And not only a little bit too late for treatment that is successful, but very much too late. And this puts big emphasis on prevention of this condition in beef cattle. Not only beef cattle, dairy as well. So once they have lesions, then cattle are prone to turn into chronic reservoirs of DD. And I've often been asked, so how come that DD comes onto our premises, into the feed yards? Well, actually, we were watching a video sequence of little calves, 500-pound calves, 300-kilogram calves, being unloaded from a truck somewhere in Colorado. Their origin was in Mississippi. And this was a video sequence from 2003. And I was sitting in a room like this one. We were watching the video, and the cameraman zoomed in onto the backside of those claws being unloaded while the cows were kind of cantering across a big metal bridge. And I looked at the sequence once, a minute and a half, no reaction. And then he repeated that video, and I said, like, are you aware of the fact that these cattle, these calves, upon unloading, already have DD? They had no idea. They had chronic DD lesions in these tiny calves, and this is when you bring those into feed yards with less than optimal hygienic conditions, they will develop outbreaks of DD eventually, and nobody had a clue. So creating awareness, training ourselves and our herdsmen about what DD looks like in different phases of the cycle of DD lesions, I think is important. So here's the DD cycle of different lesions, M0 being the healthy skin horn transition here around the coronary band, and under the influence of hygienic risk factors, you get tiny lesions, smaller than 2 centimeters in diameter. For the North American crew, it's like smaller than quarter size. At this stage, the treponemes that are causally associated with DD have not descended deep down into the dermis. And again, within 3 weeks to 3 months to sometimes 3 years, it depends on how old these animals are and what type of risk factors impact them, there's going to be a massive tissue loss into lesions, these ulcerations at the skin horn border with a white epithelial margin that are larger than 2 centimeters in diameter. And in this stage, we call them M2s. The treponemes actually have descended deep down into the dermis and into the epidermis for sure. We treat them topically and we get a healing stage. This is the same lesion, but then 1 to 2 days later, it's covered by a black scab. It's not painful anymore as much. And then from here, about 10 to 12 days later, we get the chronic forms of DD. We call them M4. And they can be either hyperkeratotic, being like a callus area within where the former lesion was, or proliferative, where you have overgrowth of the epithelium beyond the normal level of the epithelium. These lesions are the classical hairy heel warts. They have the look of a Muppet Show puppet hairdo. I wonder how my colleague in the back translates this. Within this perimeter of the former lesion, you get tiny M1 lesions. We call these overall an M4 for being chronic, 0.1 for having the new flare-ups. And from here, under disfavorable hygienic conditions, this will kind of cross over and kind of close the cycle of DD lesions. So different M stages. If I am on a feedlot, I'm able to score and see with feet on the ground the M0s, the M2s, and then all kinds of M4 lesions, either proliferative or not. And this goes pretty fast if you have some experience and are trained for doing this. So histologically, the pathogenesis of DD depends on a race, and that's the race between bacteria invading the outer layers of the epithelium, and the epithelium trying to repair that damage. And if the epithelium kind of wins, then you get an overgrowth. That's when you have proliferative lesions. And if then the bacteria are being expelled. And then if the abrasion of that overly formed material is fast enough, then you will not get the proliferations, but you get only this keratosis on top. And here you see normal skin. So here you have the stratum corneum, and then the different layers of dead cells until they become alive again. You have the stratum basale here. And actually what DD does histologically is destroy the basal membrane. When that happens due to these ulcerations, then there's total communication and disrupted growth of the keratinocytes, and a dysfunctional epithelium will be formed. So treponemes descend between these keratinocytes and the structures. They don't go intracellularly, like Staph aureus and mastitis. No, they stay in between the cells, and they disrupt, in the end, the epithelium, the formation of epithelium. So, and again, something about the pathogenesis is this race between repairing mechanisms and invasion of bacteria. Treponemes are supposed to be causally associated. It's a multifactorial disease, and polybacteria, polymicrobial. These treponemes move down into deep down into the epithelium, and actually they do something very smart. They create their own niche where the host, the cattle, cannot reach them anymore because there's all this proliferative tissue, and we cannot reach them therapeutically anymore because our topical treatment agents don't penetrate that overly grown epithelium. And please remember that treponemes, they tend to insist, they have a change in morphology from being mobile, let's say motile. They are in their spiral form and actively moving. If you expose spirochetes, and spirochetes are the general family of these treponemes. It's known that if you expose spirochetes to antimicrobials, to chemicals, and to extreme pH values, they will insist, they will undergo a morphology change. They form so-called round bodies. And what this looks like are like chains of granular structures. And they are enveloped, actually. And we see this in the lab happening between 30 minutes to 6 hours when they come out of the incubator. And it takes about 10 to 12 days for them to grow out, not on a one-to-one fashion, but one insisted chain to a multiple of wiggling spiral forms again. And nobody knows how this really happens in the skin. But what is obvious is that these spiral forms, they adhere to anything they can get a hold of, which makes it very hard to isolate these treponemes in pure culture. And there are a few people in the room who have intimate experience in how frustrating it is to try and culture pure cultures of treponemes from from these DD lesions. So treponemes insist, and once there are lesions, the treponemes are deep down in the skin. So we went and set out for a first field trial where 1,077 steers grouped into 2x3 pens in the Midwest of the US. They were undergoing like a controlled treatment, control kind of intervention trial. And the essence from that is, after correcting for all cofactors, we are able to, in our intervention group, with this amino acid complex supplement of trace minerals, we're able to slow down the transmission of DD considerably and significantly. And actually we found that in the control group there was 2 times more risk for DD lesions, being the M2s or the M4s, so the active ones or the chronic ones, after 60 days on our control supplement, compared to no change really in the risk for DD after 60 days on our test product. And then we were a little disappointed because at the beginning here, before the 60 days on supplement, there was already a significant difference in prevalence of these DD lesions. So we set out and we did it again. Field trial number 2. We had 1,120 beef heifers in 2x4 pens in this treatment control situation. And again, this time they started at a non-significantly different level. And again, the ones that were on the treatment, on our amino acid complex supplement, they actually slowed down in terms of transmission and in comparison to the control group. And this is the interaction term for predicting the M2 or M4 lesions, and this is corrected for days on feed, initial body weight, the recurrence rate of DD, and we have a random pen effect in here. So what are the key messages from these trials, really? So our treatment of a supplement significantly slowed down the development of our M2 and M4 lesions. If started early, that's really the necessity. You have to start right away when they are in this finishing situation, the cattle, and if fed at the rate that is correct for the body weight of those animals. This means you have to basically dose these supplements for the heavier animals so that everybody receives the right dosage. And Adam Geiger, sitting in the back from Zimpro, he can give you the answer as to what exactly needs to be fed. I have no commercial interest in any of these products. My role is to test them to the best of my knowledge. So, and again, this kind of significant slowing down of development of DD lesions will result in time for producers to start preventive measures and continue preventive measures such as foot baths and early detection and topical treatment and so forth. We have to take into account that there's a genetic predisposition for chronic DD, so we will in the long run be separating our genetically predisposed cattle from the ones that are more resilient and manage them differently. Here are some results from the histology. On the right-hand side, you see a normal skin with a thick stratum corneum. Here you see this disrupted stratum corneum, and these are these lesions that you can see. And what we found in 144 samples is that the biopsies from the control group, that's here, whatever it says, CX, have significantly higher profuse amounts of spirochetes. These are these green blocks in the deeper layers of the epithelium, that's the right-hand side, compared to our intervention and test product group. So apparently the skin under this supplementation becomes more resilient to the invasion of pathogens, or the race between repairing mechanisms and the invasion of the treponemes is being won by the skin. So in summary, in this awareness campaign, when you lift a foot to treat DD, you're basically too late, because the treponemes do penetrate deep into the epidermis and dermis, and therefore DD has long-term consequences. And the dynamics of DD are driven by chronic lesions, not the active big red ulcers alone. We have to pay attention as to where these chronic lesions are going. DD has significant impact on production. We have significant differences in hot carcass weights between 11 pounds and up to 42 pounds in the DD lesion affected cattle. And actually, the histological damage caused by DD is greater than what can be observed on the surface. Even if a lesion looks, or if the skin looks normal and healthy, there might be treponemes deep down in there that we cannot see. Yeah? And I think that our chronic proliferative lesions are our true reservoirs. And with this, I want to thank all my co-workers, particularly Megan, who did the first field trial, for their help with this. And if there are any questions, I'd be happy to answer. Thank you.